the most important thing to fix for ALISTAIR OVEREEM'S lip injury? What happened? How did it happen? And what happens next? Stay tuned to find out. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your #1 stop for information on broken bones and other injuries.
That's a little doctor joke we like to make around here.
Want to know more about my life as a surgeon? Be sure to follow me on Instagram and Twitter at @StableKnees. So a number of you have asked me to comment on this particular injury in the comment section of my previous videos. So today, I figured that I would do that for you. ALISTAIR OVEREEM is a heavyweight fighter in the UFC, and he was injured during a fight on December 7th of 2019. ALISTAIR OVEREEM was fighting in the main event against fellow heavyweight Jairzinho Rozenstruik, or Biggie Boy. And ALISTAIR and Jairzinho were fighting in the 5-round main event. And although these fighters are heavyweights with hands of stone, they both managed to last for the full 5 rounds of the fight. During the last 10 seconds of the fight, that's correct, I did say the last 10 seconds of the fight, while backing away from Jairzinho, ALISTAIR was unfortunately caught by a right hand thrown over the top by Jairzinho on the left-hand side of his face. Jairzinho's hook caught ALISTAIR flush on the left-hand side on the upper aspect of his lip. And unfortunately, ALISTAIR suffered a full-thickness laceration of the upper lip on the left-hand side of his face, which basically left his lip in tatters, like it was hanging off the side of his face. The fight was stopped by the referee at this point, and it was ruled a knockout, or a KO. However, if it had not been ruled a KO, it would have been ruled a TKO, or technical knockout, because there is no way that the doctor would have allowed ALISTAIR to continue fighting with a laceration like that. So now that we know what happened, how did it happen? Well, obviously, Jairzinho throws a punch with a lot of power. And the punch that he struck ALISTAIR with was a hook. So as that hook comes across ALISTAIR's face, that punch introduces a shear force, or a force that is applied perpendicular to the surface, a shear force across the surface of ALISTAIR's skin. And because the skin is fixed to the skull and only has a small amount of play, one direction or the other, there is only so much force that the skin can accommodate before tearing or ripping may occur. This was a full thickness laceration, or a full thickness tear. And as such, it involved all layers of the face. And this includes the skin, the muscles underneath the skin, and the oral mucosa, or the lining on the inside of the mouth. Other structures that were involved include the sensory and the motor nerves of the face, and the blood vessels of the face as well. And when we look at the pictures of the laceration, we can clearly see that this tear goes all the way through, and his dentition, or his teeth and gums, are exposed through the opening behind the tear itself. And while many lacerations can be typically treated in the emergency department by the attending physician, the severity of this laceration will likely require the additional expertise of a plastic surgeon. This is a laceration that will need to be repaired in layers. The oral mucosa, or the lining on the inside of the mouth, will need to be repaired as a separate layer. And this will be independent of the repair of the muscle layer, which includes the orbicularis oris, or the muscle that allows you to purse your lips. Both of these layers are typically repaired with moderately fine interrupted absorbable sutures. The skin, on the other hand, will be repaired independently using fine filament non-absorbable nylon sutures. And this just basically means that the sutures on the inside are able to be absorbed by the body, and they do not need to be taken out at a later date. Whereas the sutures that are used on the skin are non-absorbable, and they will need to be taken out after the skin edges have reapproximated and healed to one another. Sutures that are used on the face are of a fine filament and a very small diameter to minimize the chance of scarring after the sutures have been removed. But the most important thing when fixing the face, and especially when fixing the lip, is the restoration of the vermilion border. And basically, that's this line of your lip right here. And this repair needs to be Exact. Because even a 1 millimeter displacement of the vermilion border will be seen as disfiguring when people are looking at that person's face who has had the repair. So typically, when repairing lacerations that involve the lip, the vermilion border is repaired first to ensure that it is restored exactly to its previous condition. Also, whenever a patient has suffered a laceration, it's important to ensure that their tetanus toxoid or their tetanus booster is up to date. So with all that being said, what happens next? At some point, he's going to return to fighting in the future. How long will that take? Generally, we can expect his lacerations to heal over a period of several weeks. While the skin edges might heal over a period of approximately 7 to 10 days, it will take the underlying muscle an extended period of time to reapproximate and come together. Because of the location of the laceration, there is some possibility that he may have some lifelong sequelae or lifelong complications that are associated with this injury in the future. Because this laceration involves the orbicularis oris muscle and is located in an area where the facial nerve is found, it is quite possible that he may have altered motor function of his lip on the left-hand side of his face in the future. This may manifest itself as difficulties in speaking or a minor speech impediment as a result of paralysis of the left-hand side of his upper lip. It may also cause difficulties when he is eating or drinking, and it may cause food to leak out of the corner of his mouth. In addition, because of the involvement of the trigeminal sensory nerve, he may also have numbness on the left-hand corner of his upper lip. Finally, if they're unable to restore the vermilion border of his lip when they repair this laceration, then ALISTAIR OVEREEM may have some ongoing disfigurement as a result of this injury in the future. So there you have it. Today I've been talking about the most important thing that needs to be fixed for ALISTAIR OVEREEM'S lip injury. Be sure to like, share, and subscribe, and keep your eyes out for membership options to this channel coming soon. And as always, that's been a word from Dr. Chris, not your everyday bang!
Just a flesh wound.